You're not gonna see it. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Is there a motion to adopt the agenda as presented?
So moved.
Second. Lou seconded.
Second.
Any questions on the agenda? If not, roll call please.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Dr. Furster,
Yes.
Mr. Dubus,
Yes.
Mr. Adavasio,
Yes.
Mr. Messersmith.
Yes. The next item is the election of officers, and since our Jack, our vice person, isn't here, I'll turn the meeting over to Frank. So we'll elect the officers with Mike.
Sure.
Okay,
At this time, I will open the nominations for our board president. Do we have any nominations?
Yeah, I would move to renominate our current president and co-chair.
Okay, so we want to do them both together,
Yeah, that's good enough.
president and president pro tem, keep the two the same as they are. Do we have a second on that?
I'll second.
Anyone else? Anyone else want to nominate someone? Hearing none, we'll close the nominations and take a vote.
Mr. Barry,
Yes.
Mrs. Salapata,
Yes.
Dr. Furster,
yes.
Mr. Dubus.
Yes.
Mr. Adavasio.
Yes.
Mr. Messersmith.
Yes.
I'll turn it back over to you.
Thank you. And we welcome Dr. Furster on the board again. He won a very close and well bidder election. Close. Okay, the next item is the approval of the minutes of February 28th. Is there a motion to approve the minutes? So moved. Is there any additions or corrections? Any questions on the minutes?
Mr. Dubus,
Yes.
Mr. Adavasio,
Yes.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Dr. Furster,
Yes.
Mr. Messersmith.
Yes. Okay, the next item is the Health Commissioner's report.
Thank you, Mr. Chairman. First, you have my written report, and I can take any questions on any of the items that are on that. A few things that I just want to point out that may not be on this report. First and foremost is that you'll see that our nursing director, Erin, as well as Jenna, are not here today. That's because they are attending the NACHO conference. That's basically, NACHO is across the country. It's a a federal organization that oversees a lot of health topics, especially right now they're focused on the issue of equity and public health. And so through that health equity grant that we received through the workforce development, they were able to attend that. So we actually have 3 in attendance there, and that's why they're not at the conference. As you heard our board president mention about the district advisory council meeting that was held on the 20th. As some of you that were there, but maybe some, I know everyone wasn't there, but we struggled to get a quorum at that, but eventually we did receive a quorum at the meeting, so they were able to conduct their business. And I want to congratulate Dr. Furster on being reelected to the Board of Health as our physician on the board. So we welcome your value input month in and month out, as well as in between.
Well, the cupcakes that were left over, Dr. Furster, was for you. You took them over instead of bringing them today. I hope you took an extra one.
The dog and I enjoyed very many nights of television with those cupcakes.
I also want to make mention, as you know, the last board meeting that we had stated about bringing in some additional employees. So we did an internal posting first. We did not receive any internal applicants. I will say as you can see in my one note, one of our public health nurses is retiring, so we need to fill that position. That individual solely worked on grants, which we would not need a public health nurse to do that work. It's basically the harm reduction through accidental overdoses. And so between that and the additional work, because we want the additional work to be in that linkages grant, which is also deals with substance abuse and overdose. So we posted for health educators. So that's what we're gonna be hiring, is 2 health educators at this point. And so we did receive a number of external applicants, and we have them set up to be those individuals to be interviewed early next week. You will probably also see that if you haven't, maybe when we're done, you just walk out and down the stairs here. You'll see that we are in the process of remodeling that one large room into 2 rooms. So that's where our nurses will be getting shifted to as their work duties we're looking to assess and figure out how we're gonna adjust their work, but they're gonna be more in line with doing more or less public health work and lesser amount of grant work. So as we transition our health educators, once we have them on board to relieve the nurses of some of that work, they can assume duties into more public health nursing work at that point. So as such, we're gonna be moving them closer to the clinical area that's up front in the building. That's my report, and I can take any other questions on what's in my written report or what I just mentioned at this time.
Can I just ask, I know, that she was involved mainly just, or she was, that was totally, is that going to leave? A vacancy like in the nurse, are they still have enough nurses to fulfill all the jobs that need to be done? Cause I
Yeah.
know sometimes she would give, if someone came in, had to give a shot or something.
Yeah, that's a fair question, and I will tell you this, she was written 100% in the integrated harm grant, and the other grant that was known as a prescription drug overdose. So she really, I mean, it really had to be a rare occasion where there was literally no one else in the building and someone showed up without an appointment and needed the vaccine, that she would administer that. Honestly, I would tell you that for the most part, Sandy, when she was our nursing director, and or Aaron would most likely give that vaccine in lieu of. That's how much that her dependence was on that grant. So, yeah, I understand that, but having 3 public health nurses here and Aaron having a good understanding of how we're gonna shift their work. We're gonna do our best to make sure that there's always a public health nurse in the building to in that, special occasion that they'll be able to administer a vaccine if need be. So I will tell you this, depending how things go, we'll have an answer real soon on the Family Connects grant. And once we know for sure on that one, and we understand all that would be required of us in that, I may be coming next month to you and saying we may need an additional public health nurse. We just have to see, if we know for sure that we get it, and B, what the number of personnel that will be required within that.
Okay.
Thanks.
Any other questions? Is there a motion to accept the report as presented?
So moved.
Second? Second. First, no further questions, roll call. Yes, you have a question.
Just, and I don't remember, it's been 3 days since I read that stack of papers that the young lady sent to us. Was that report inclusive of the credit cards? Was that part of that?
Mhm.
Yes.
And I understand that, the world's expanding and our need is expanding, and you've doubled it, or it was doubled, and we're now utilizing if we need to. Where are those housed? Do somebody have them? hey, I'm going somewhere, I need a credit card, or?
Yes, yeah,
What's
we
that?
have a policy on how to control the use of it. And they are mainly in possession of Jonna,
Okay,
and there's a sign out sheet, so we know who took it, what day.
They're in the locked file cabinet.
Yeah,
okay,
yeah,
I'm
it's,
just curious, I
it's,
need a little gas today.
yeah, there's a lot of there's a lot of accountability for the use of the credit card.
Sounds good.
Any other questions? Roll call, please.
Mrs. Salapata,
Yes.
Dr. Firster.
Yes,
Mr. Barry.
Yes.
Mr. Dubus.
Yes.
Mr. Adavazio.
Yes.
Mr. Messersmith.
Welcome, Dr. Henry. I'm sitting down here by myself on an island. The next one is the Director of Nursing report that you have.
Please.
Yeah, she supplied a written report. And if anyone has any questions, I can either refer those to her. And I can jot them down, or I can maybe answer them.
Are there any questions on the report from anybody? There's no questions, or is there a motion to accept the report? Mr. Barry? Second by,
I'll second.
any questions, roll call please.
Mr. Barry.
Yes.
Mrs. Salapata.
Yes.
Dr. Firster.
yes,
Mr. Dubus.
Yes.
Mr. Adavazio.
Yes.
Mr. Messersmith.
Yes. The next one is the Director of Environmental Health.
Thank you, Mr. Chairman. I provided a written report. The only thing I will add is the board remembers, I believe in November of last year, Georgetown brought us an unfit that was tabled, on tape. Since then, is a new owner and they have torn the house down. So no further action is needed on that one. Look, I'm happy with that. So, other than that, I can answer any questions you may have.
On the back page, you shortened it, you changed it, you squeezed them together.
Yeah. Yeah, this was just, as we talked about last board, it was just for the last month.
Okay.
So it's a little bit more concise. It's a little bit more than just sewage. It has some solid waste on here and so forth. So it's a little bit easier to read too, I believe.
Is there any motion to accept the report as presented?
So moved.
Second by,
I'll say that.
or any questions? No questions, roll call please.
Mr. Dubus.
Yes.
Mr. Barry.
Yes.
Dr. Firster.
yes,
Mrs. Salapata.
Yes.
Mr. Adavazio.
Yes.
Mr. Messersmith.
Yes. The next one is the grant coordinator report. In her absence, we have a report. Any questions, Frank? Can you comment on that?
No, I don't have anything to add to her written report.
There's a motion to accept the report as presented, so motion. Second by,
Second.
any questions? If not, roll call please.
Mr. Adavazio.
Yes.
Mrs. Salapata.
Yes.
Mr. Barry.
Yes.
Dr. Firster.
yes.
Mr. Dubus.
Yes.
Mr. Messersmith.
Yes. And the next one is the accreditation coordinator report.
Thank you, Mr. Chairman.
Wait a minute, yes, I got them out of order, I'm sorry.
Thank you, Mr. Chairman. I provided a written report to the board. I'll take any questions if you guys have anything.
Are there any questions for him on the report? If not, motion to accept the report as presented,
So moved.
seconded by.
Second.
Thank you, Mr. Phillips. There's no other questions, roll call please.
Dr. Firster.
Yes,
Mr. Dubus.
Yes.
Mr. Barry.
Yes.
Mrs. Salapata.
Yes.
Mr. Adavazio.
Yes.
Mr. Messersmith.
Yes. The next one is the health educator report. You have one in front of you. Any questions, comments on that? Is there a motion to accept the accreditation or the health educators report as presented?
So moved.
Second by
Yes, second.
Mr. Barry.
If I could just
Oh, you have.
Make one comment.
Okay, before we
Yeah,
have those in
just-
comments, please.
In the coming months, you'll probably see this format change a little bit as we have additional health educators. I'll have them drafted up as a combined report to give you an update on the work being done through our health educator program.
That'll be the people that we're currently going to hire.
Correct.
Good.
But it'll be coordinated through Chris Cribbin.
Okay. You won't have time to hunt for the food deserts, will you then?
I'm sure he'll still have time.
Is there a motion to accept the report?
We had,
We got a roll
yep.
call, please.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Dr. Forster,
Yes.
Mr. Dubus.
Yes.
Mr. Adavizio.
Yes.
Mr. Messerschmidt.
Yes. For the board report, I'd just like to add that the advisory meeting that we had last week, the food was excellent. Whoever was in charge of getting this, well received. Right, Kathy?
Yes, very good.
Very good. Unfortunately or fortunately, I mean, there were 17 people there. We needed 18. And we finally got the one commissioner who came
Yeah.
late and made it. And we could, in the rules of that meeting, if we had a commissioner, we could have formed a committee of 5 and gone on. But the commissioner has to be one of the 5 who can form. Most of them seem very, well, they're impressed by the ability. Okay, the next one is any old business? Yes, sir.
Yeah, so the last month I brought to the board, the results of our survey for food. I just want to let the board know that the state has replied and they've accepted our plans to correct those issues, so they're happy with what we proposed.
Okay, were all the deficiencies corrected then?
Well, we're in process.
In the process, very good.
Yep.
Very good. Okay, new business. Okay, the first one under A is the approval of Erica Clark to attend the convention, May 7th to May 9th. It's all paid for by not us.
Are you doing Erica's or are you doing Aaron's?
Erica's, I have on mine.
Aaron's not on this new business one.
Under A,
Yeah.
new business A,
On the new one?
Well, not on your.
Not on the new one, on the old.
No.
I didn't take it off. I didn't take it off.
It's not how it
It's on
came
the
off.
old one.
Somehow it came off.
Yeah, because
Alright,
before
well-
we had tea and milk.
Aaron's is still on there for nachos.
I have her,
It's on the old one.
Yeah, her write-up should be the first
Yeah.
one.
which one?
Aaron Heckman's.
Okay, turn the paper upside down and put them over that. All right, same thing, it's all paid for, and we just have to have permission since they're going out of the area to grant her that opportunity. Is there a motion to that effect?
So moved.
Second by,
Go ahead.
Bob, seconded. Any questions or comments? Yes, sir.
You say it's paid for. Is that award? That travel award, whatever it's
It,
called?
it is, and it's
That's
a,
for 2 people though, isn't it?
no, for this one, we were able to get funding for 3.
For 3? Okay.
Yeah, and it's specifically, one of the major components deals with, emergency preparedness. With when you see the thing about the MRC, the Medical Reserve Corps, they are an organization of volunteers, a group of volunteers that we solicit here between us and
Right.
our county and Mahoning County to help out. They helped us immensely with, COVID, our COVID response. So, it's really looking at ways that we can improve that. And so, yeah, the federal government has funding sources as well as NATO. Again, they're a nationwide organization that give these scholarships to attend these type of trainings. So that's what they did. They were able to receive funding through that.
If I'm not mistaken, it's for everything, isn't it? Flight, room,
You're correct.
food, the whole.
It covers everything.
Okay. Thank you.
Any other questions? Roll call, please.
Mrs. Salapatta,
Yes.
Mr. Barry,
Yes.
Dr. Firster,
Yes.
Mr. Dubus.
Yes.
Mr. Adavazio.
Yes.
Mr. Messersmith.
Yes. The next one is a similar one for Eric and Clark.
So moved.
Second,
I'll second that.
any questions on it? Roll call.
Yes.
Yeah. Thank you. Mr. Dubus,
Yes.
Mrs. Salapatta,
Yes.
Mr. Barry,
Yes.
Mr. Adavazio.
Yes.
Mr. Messersmith.
Yes. The next one is also for a travel award for Maria O'Brien. Going on,
And Maria, just so everyone knows, the reason why we want her involved in it as well is because she's the individual taking over for pod distribution. So again, there's gotta be direct coordination there with her as well as the Medical Reserve Corps. So as that transition, that was a little piece of stuff that Kathy did do in the past. And so that's, that little bit that she did do is 100% being transferred over to Maria. So we need to get her up to speed on the use of Medical Reserve Corps in conjunction with running pods.
any questions? A motion to accept it, Dr. Firster. Second,
Second.
no questions, roll call, please.
Dr. Firster, Mrs. Salapatta,
Yes.
Mr. Barry,
Yes.
Mr. Dubus.
Yes.
Mr. Adavazio.
Yes.
Mr. Messersmith.
Yes. Okay, going into the variances and declarations phase. The first one is the variance request from Ron Kessler. 822 Walls Lake, Lyon Township.
Yeah, thank you, Mr. Chairman. This is me. So this is a variance request, due to the configuration of the new install, it wouldn't be able to meet the setback requirements. So in short, I'd ask the board to grant the variance, and adopt the motion as presented so they can install closer than 10 feet.
They're not here, right?
I don't know.
So motion.
You guys run Kessler.
Motion was made. Second. Any questions? Roll call.
Who's second?
Mr. Barry.
Who made the first one? Then I missed that.
Evans.
Thank you. Mr. Adavazio,
Yes.
Mr. Barry,
Yes.
Mr. Dr. Firster,
Yes.
Mrs. Salapatta,
Yes.
Mr. Dubus.
Yes.
Mr. Messersmith.
Yes. The next one is for unfit. 1288 Cedar, Graceville Township. You have two papers maybe. There was something missing on the one and it's been added on the second one, right?
Hold on, I'm out of order here. 1288.
Yeah, they look like me, they're the same. Either have one, we did last. Here you go.
You have the folders.
I think it's, okay, appreciate that, Bob. Okay, so this is declaration, this request came from Braceville Township, to look at this structure and see if there's different human habitation. Looks like we found mold and moisture contamination, gross and sanitary conditions. Floors and collapsed, basement is flooded. So I'd ask the board,
Is those the picture that was? That wasn't Cedar Avenue, was it?
Yeah, this is it right here.
This is, okay,
so I'd ask the board to declare the structure at 1288 Cedar, unfit for human habitation.
is there a motion to that effect?
So moved.
Second,
Second.
Kathy. One of you represent. Let us know who you're representing, please, so I don't. I won't.
Do you guys have anything on the board, or you guys just hang out the wall?
Township,
Okay,
Okay,
okay.
just here to learn.
Who do you have?
Dryden City,
Okay, what's the address? Just so I know.
727 Road.
Okay, cool. All right, well, if I forget to acknowledge it, just remind me.
and ma'am, are you with him or are you?
Yeah, they're from
Oh,
Hubbard Township.
But we're separate.
Oh,
You're separate,
Yes.
separate cars you drove?
Yes. Yes.
Both getting mileage,
Isn't it?
good. You don't have a case in front of us. You don't, do we? Oh, she does. Okay, whatever. When we get there, hold your hand up, so I'll be distracted and look at you. Cause this clock's making me blink all the time. Okay, the next one.
Wait, I need to call, yeah.
Roll call.
Mr. Dubus?
Yes.
Mrs. Salapada?
Yes.
Mr. Barry?
Yes.
Dr. Furster?
Yes.
Mr. Adavasio?
Yes.
Mr. Messersmith?
Yes. The next one is 3652 Warren Vanna Road, Graceville Township, Charles Wallace.
Okay, also came from Rachel Township trustees. Looks like we got some, flooring issues, missing ceiling, presence of solid waste, mold and moisture, gross unsanitary conditions. I'd ask the board, to adopt the motion for that.
Is there a motion to that effect?
So moved.
Second. Hold on, Greg, you're not studying, you're not gonna buy these properties. Is there a second?
Dr. Furster?
Roll call, please.
Mrs. Salapada?
Yes.
Dr. Furster?
Yes.
Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavasio?
Yes.
Mr. Messersmith?
You have to leave, right?
2:00.
Oh, 2 o'clock, oh, we'll be almost done by then.
I need your vote, Mr. Messersmith.
Yes. Okay, the next one, 6343 Carlson, Upper Township, Robert and then Shaw.
Okay, this one comes to us from Hubbard Township zoning. Missing tiles, flooring, present solid waste, mold and moisture, gross unsanitary conditions. There's a note here that says structures in horrible condition.
Oh.
So I'd ask the board to adopt the motion as presented.
Is there a motion to that effect?
He
Yes,
was-
But we,
he's
after we
representing-
get the motion, we can.
East
let him-
Hubbard Township.
He raised his hand.
Oh, you did raise your hand?
Yeah, he raised. it.
I'm sorry.
Yeah, I know. We'll,
I'm
we
sorry.
gotta make,
for the
we gotta make the
instructions.
motion, then we'll have to comment
So moved.
before we can vote.
Okay.
Mr. Barry, seconded. Yes. Okay. You have a comment on this property, sir?
The only comment that I have is I'm here representing Upper Township zoning. And I knew that there were several properties that we had on the unfit. So
You
that-
agree that it's unfit?
we were the ones that were, I was the one.
Yeah,
that
they
requested
asked.
it in the
He didn't
first
change
place.
his mind.
I did not,
Okay.
no.
I'm sorry, sir. Can I have your name?
Stephen Zubik,
Thank you.
ZUBYK. You're
That,
welcome.
that's why I was confused when you wanted to speak. I was confused. That's all. You're the one that
Like
turned
I
it
said,
down.
I'm just
You wanna talk
following the
about it.
instructions. We've got the rule
Okay,
nominated
gotcha.
clock over here.
That's right.
You've been to all these homes, right?
Several times. Not inside them. I don't go inside.
Roll call, please.
Mr. Dubus?
Yes.
Mr. Barry?
Yes.
Dr. Furster?
Yes.
Mrs. Salapada?
Yes.
Mr. Adavasio?
Yes.
Mr. Messersmith?
Yes. The next one also is 6425.
Mason.
Was the last one Shaw? Okay, this is the Mason. 6425 Mason, Shaw T. Raymond owner. Sean T. Raymond, anybody?
Is this also on Howard?
Yeah.
Bunch of these are- Okay, so this is Hubbard Township, zoning, our friend over here turned this in, missing valley damaged ceiling tiles, present solid waste, gross unsanitary conditions. There's a note here that says, the ceilings and walls are in full collapse, so I'd ask the board to adopt the motion as presented.
Is there a motion to that effect?
Second.
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 Are you the, do you have any comment on this, sir? Are you the zoning inspector?
The zoning administrator for the town.
How did you let it get this far along if they're so bad shape?
I've only been in this position about a year and a half.
Oh, okay. You, they needed before. Roll call, please.
Dr. Furster?
Yes.
Mrs. Salapada?
Yes.
Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavasio?
Yes.
Mr. Messersmith?
Yes. The next one is 1936 Wick Campbell, Hubbard Township, Richard, oh,
Okay, Hubbard Township zoning, missing valley damaged ceiling, present solid waste, gross unsanitary conditions, horrible condition. I'd have the board to, adopt the motion as presented.
is there a motion to that effect? Second?
I'll second that.
Looks like you inherited
That's why they don't go into the ones where it's
Yeah.
structurally unsafe.
Roll call, please.
Mr. Adavasio,
Yes.
Mr. Dubus.
Yes.
Mr. Barry,
Yes.
Dr. Firster, Mrs. Salapata,
Yes.
Mr. Messersmith.
Yes. The next one. 2859 Bell Wick Hubbard. Patricia Elser.
Okay, this one comes from Hubbard Township zoning, presence of solid waste. Gross unsanitary conditions, home is in collapse. Well, I'd ask the board to adopt the motion as presented.
Yeah.
Yes.
Yes, after we,
Yep, he'll let you know. Thank you.
is there a motion to that effect?
So moved.
Dr. First, seconded. You got it. Yes, ma'am.
So this is wooded property and my parents purchased it in the late sixties. We were not aware that this structure was on this property because most of the time when the leaves are in bloom, you cannot see this property. So my mother died 4 years ago and I inherited the property. Was not aware that this structure was there.
You didn't live next door.
I didn't live anywhere near this. No, no. And I've never known that anybody, as far as my parents, as long as my parents owned this property, nobody ever lived there that I know of.
You
We
didn't have
weren't even
family
aware that that was there.
I wonder who paid the taxes that had a property listed, a structure listed on the taxes,
If there were any.
if there were.
Well, I'm paying the taxes now.
I know, but to be, I'm just out of curiosity, did they, when you got your taxes, they have dwelling and land? Was there a dwelling listed?
It wouldn't show it on there. I don't. That's
No,
Okay, well then you have no hardship against the board if we vote to declare this unfit.
no.
Okay, thank you for your.
I'm sorry, is your name Patricia Elsler?
Ellisor.
Ellisor.
Ellisel.
All right, thank you.
Mhm.
What are you from, Pittsburgh?
Okay,
So how it works, is that the board will declare it unfit and give it back to the township, and you can either work with them. But as they may have told you about, the planning commission has some money to help with some of these tear down. So our role is to declare it unfit and then it goes back to the state, we'll work with Hubbard to see. the next
So
step.
that, okay,
Okay.
I understood.
either that or grass.
If you don't, just give me a call.
Okay.
More, yeah, we'll work with it.
Okay.
Yeah.
There's open burning ones, you know. You can't start a grass fire. Roll call, please.
Mrs. Salapata,
Yes.
Dr. Firster,
Yes.
Mr. Barry,
Yes.
Mr. Dubus.
Yes.
Mr. Adavasio.
Yes.
Mr. Messersmith.
Yes. The next one is 6473 Rosner, Hubbard Township, Donald Acton.
Okay, Hubbard zoning. Missing ceiling tiles and collapsed walls and collapsed present solid waste. General gross and sanitary conditions. I'd ask the board to adopt the motion as presented.
Is there a motion to that effect?
So moved.
Second,
Second.
roll call, please.
Dr. Firster,
Yes.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Mr. Dubus.
Yes.
Mr. Adavasio.
Yes.
Mr. Messersmith.
Yes. Okay, the next one is 432 Hartsel Avenue, Gerard City, Alice and Chris.
Okay, this comes from Gerard City officials. Gross unsanitary conditions, no water at this property as well. So I'd ask the board to declare that, or to adopt the motion as presented.
Is there a motion to that effect?
So moved.
Seconded. No comments, questions, roll call?
Mr. Dubus.
Yes.
Dr. Firster,
Yes.
Mr. Barry,
Yes.
Mrs. Salapata,
Yes.
Mr. Adavasio.
Yes.
Mr. Messerschmidt.
Yes. The next one is, 132 Olive, Gerard City. Terrence is the owner.
Okay, another one from Jordan City, mold and moisture contamination. Thanks, gross unsanitary conditions. So I'd ask the board to adopt the motion as presented.
Is there a motion to that effect? So moved. Second.
Second.
You have a comment on this one, sir?
He's the next one.
Oh, okay. Roll call, please.
Dr. Firster,
Yes.
Mr. Barry,
Yes.
Mrs. Salapatta,
Yes.
Mr. Dubus.
Yes.
Mr. Adavasio,
Yes.
Mr. Messerschmidt.
Yes. The next one is,
Just one question.
sure,
My wife wanted to make it, but she couldn't. And with your permission, I'd like to take it.
you may.
Thank you.
That's better. We had a board member that used to take things in executive session. Thank you for asking.
You're welcome. Thank you.
She isn't with us anymore.
Okay, so I'll run through it and then we'll, Mr. Orban talk. So this is from Gerard City, came over, present solid waste, mold and moisture, gross unsanitary conditions. So I'd ask the board, to adopt the motion as presented.
Is there a motion to that effect? Someone. Second.
I'll second it.
Thank you. Yes, sir. You want to speak now, please?
Okay,
Your name is,
Ron Orban.
okay,
It's listed as Ronald Orban.
all right. What do you have to say about it?
Okay, well, the thing is you drive by Mosier and 80, okay? The house sits back about 180, 200 feet. We've taken care of pretty much, we've got all the siding done. We put up, a lot of money. I mean, brand new little porch. And the thing is I'm still working on it, and I have a contractor that I've paid some money to take care of a couple other little issues that I have outside. And then I've been cleaning the last 2 weekends inside the place. And sweeping it up, cleaning it up, wiping it down. The thing is, the house is in good repair. It was like, I come from Cleveland and, I don't know, much about Gerard or anything down here, but I like its, country setting. It's, the house, I mean, how many people get to buy or, do a fixer-upper project that was built in 1884? That's true oak 2x4s, that's structurally sound. And, we're in the process of, me and my wife working on it and stuff, and I do have, contractors, lined up for it too. To help me with additional repairs and stuff.
So, and what I would suggest, and that's great to hear. is-
Right.
keep in, like you said, keep in contact with the city,
Right,
because how it works is they ask us, and the simple form of it is, can somebody live there now? The answer is no, the board would declare it, under human habitation, but
right,
we'll give you a time, because the city, there's different ordinances, they give you a time frame. If you get close to the end of the time frame, call us, let us know, keep us in the loop, but definitely work with Gerard City. Because if you get crews in there, it's an obviously remodel, they will most likely say, okay, guys, hold on, they'll tell us just hang on anything going forward.
okay,
And then when they are happy to what it looks like inside the building, they will then request that the board rescind the declaration. So they ask for it, the board gives it, then they ask for it to be undone, so to speak. So everything has to run through Gerard. So I would encourage you to definitely keep in touch with them for sure.
yeah,
And we talked before, you have my number, call me with updates if you got questions. But if we don't hear from you for 60 days or whatever, and Gerard is still, hey, this guy hasn't done anything, then it'll go to the next step.
right, I've been taking pictures,
Yeah, got it.
taking pictures where I've been cleaning up and everything.
Yeah, make sure anything you
Wiping
communicate with
down, like
us,
you said.
they are the ones that are driving this, so make sure they're in the loop. for
Right,
sure.
oh, I will,
Okay,
yeah, I'll talk to Dan,
okay,
Nancy's good.
okay, cool. Thank you. Yep, and like I said, give me a call if you got anything.
Oh, I will, and I'm gonna keep you in the loop
Okay.
too.
I appreciate it.
And we do rescind the unfit when it comes, the agency declares that it's okay, we can do that.
Okay, thank you.
Yeah.
Yeah, I mean, I just don't, you know. I wanna put every dollar that I have into it and stuff, but the thing is, I just don't want, you guys to say, well, you know what, that's nice, you tried, you put. I'm throwing out as an example, say $30,000 into it. Now, that's it, have a nice day.
No, that wouldn't be our call anyways. Gerard is they're driving the bus. Okay, the Board of Health's role is simply to declare it unfit, but it's gonna be between you and Gerard up until a point. And if nothing's happening, that's a different story, believe me.
Right, but if I'm trying and I'm
You're trying.
working hard and stuff,
Absolutely,
then you guys will work with me?
yeah, I'll do everything I can for sure, if you're trying, yeah.
Thank you.
Any other questions or comments? If not, roll call please.
Dr. Firster?
Yes.
Mr. Dubus?
Yes.
Mr. Barry?
Yes.
Mrs. Salapata?
Yes.
Mr. Adavasio?
I'm gonna vote no.
Mr. Messerschmidt?
Yes. Sir, if you get that taken care of, this lady next to you, she has a country setting on the property, maybe she would like to have the, more so than in the city of Gerard.
When you get the paperwork, if you don't understand or whatever, just give me a shot.
Okay, thank you. Thank you.
Don't panic, it's always tell people.
Yeah,
don't panic.
that's where we're
Yeah,
at.
don't
I mean,
panic.
literally, when I got your letter Friday night,
Yeah.
we got a hold of you Tuesday.
Yeah.
I couldn't eat or anything.
Don't panic, just give me.
I mean, that's how bad it was, and I'm being truthful.
I got you. Don't panic, you'll be all right.
Thank you.
The
I
major-
mean, nobody wants us on them.
All right,
Right.
You know?
sir, you know how many
Oh, I'm
we've
sorry.
gone through today? You're the only one that, two people represent came. That's odd. Usually you have nobody show
Yeah.
up on their case. And if
Yeah.
you show up, you get bonus points.
Right.
Oh, well, thank you, sir.
And they're redeemable in the parking, free parking space.
What if you pulled on the street?
No, we have nothing over the street. No, we appreciate you coming.
Well, thank you.
We might not be so happy the next time we see you, but we appreciate you today.
Okay.
Okay, the next one is 211 Broadview, Gerard City, Susan Turner.
Okay, so this comes from Georgia City officials, presence of solid waste, mold and moisture contamination, gross unsanitary conditions. I'd ask the board to adopt the motion as presented.
So moved. Second,
Second.
any roll call? Is there any comments? If not, roll call please.
Dr. Firster?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavasio?
Yes.
Mr. Messerschmidt?
Yes. The next one is 1026 State Street, Gerard City. 422 JMP LLC owner.
Okay, another one, Georgia City officials. Looks like we got no flooring, missing badly damaged ceiling tiles, present solid waste, gross unsanitary conditions. I'd ask the board to adopt the motion as presented.
Is there a motion to that effect? So moved. Second,
Second.
any comments or questions? If not, roll call please.
Dr. Firster?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavasio?
Yes.
Mr. Messerschmidt?
Yes. The next one is 246 Prospect Street, Gerard City, George Bismarck.
Here's Mark, yeah. So another one from Georgia City officials. Present solid waste, mold and moisture contamination, gross unsanitary conditions. I'd ask the board to adopt the motion as presented.
Is there a motion to that effect?
Second. Second.
Make the first.
Any questions or comments? If not, roll call.
Mr. Adavasio?
Yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mrs. Salapata?
Yes.
Mr. Dubus?
Yes.
Mr. Messerschmidt?
Yes. The next one is 50 Abbey Street, Carmen Malone, owner. Also Gerard.
Yeah, this is Gerard, city officials, gross unsanitary conditions, no heating components, no electricity, no water. I'd ask the board to adopt the motion as presented.
Is there a motion to that effect? First, second? Second. Great. Any questions or comments? If not, roll call please.
Dr. Firster?
Yes.
Mr. Dubus?
Yes.
Mr. Barry?
Yes.
Mrs. Salapatta?
Yes.
Mr. Adavasio?
Yes.
Mr. Messerschmidt?
Yes. The next one is 217 West Prospect, Gerard City, Meadow Lewis Estates LLC.
Gerard city officials, present solid waste, mold and moisture contamination, gross unsanitary conditions. I'd ask the board to adopt the motion as presented.
Is the motion to that effect? So, second,
Second.
any questions or comments? If not, roll call please.
Dr. Firster?
Yes.
Mrs. Salapatta?
Yes.
Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavasio?
Yes.
Mr. Messerschmidt?
Yes. The next one. 18 Cherry Street, Gerard City, Michael Stefani.
Okay, Georgia city officials, present solid waste, gross unsanitary conditions. I'd ask the board to adopt the motion as presented.
So moved. Second,
Second.
any questions or comments? Roll call please.
Dr. Firster?
Yes.
Mrs. Salapatta?
Yes.
Mr. Barry?
Yes.
Mr. Dubus?
Yes.
Mr. Adavasio?
Abstain.
Mr. Messerschmidt?
Yes. The next one,
Mr. Chairman,
yes.
I'd just like to explain my abstaining on that. The person who owns that house, I'm friends with his brother, and I have received things of value from his brother in the past. Possibly will receive them in the future, so there would be a conflict of interest for me to make any vote on that. That's why I abstained.
That's fine. Appreciate your input. This is the last one, 2 South Davis, Gerard City, Lou Adavasio.
What comes to us from Gerard city officials, present solid waste, wood, metals, gross unsanitary conditions. I'd ask the board to declare, or I'd ask the board to adopt the motion as presented.
The motion to that effect? So moved. Second,
A second.
any questions or comments? Yes, sir.
And I'd like to make a comment, as you can see from that picture there is no solid waste. Most of that stuff that you're looking at there is wood and other construction materials. We're going into putting the place back together. There's no unsanitary health conditions, there's no leaking roof. The roof has been replaced, the I-beams have been installed, windows have been put in. A number of years ago, I went to court over this same structure when the Gerard Board of Health condemned it. As I told them, under the law, you have to have health concerns, health conditions. What you're looking at is some shelving and other construction material that is going back into place to put the place back together. The metal and stuff you see on the floor was hastily thrown in there, but it is all usable and it's construction material, not solid waste. The only other thing I'd like to add is when I went to court over this, I was successful in the past, and I believe I will be successful again. I know the board isn't I don't mean to put anybody in a bad place as a member sitting on the board. I'm just giving you that, and I'm sure I'm going to go to court again, but I just want to explain that so you know where I'm coming from.
Okay. No other comments? Yes, sir, doctor.
Just want to review this process so that I understand it better. How did this get here? If these are all construction materials, the new roof, the studs have been put in, blah, 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 blah. Who did the evaluation to say this should come to this board?
George said he asked us to do the inspection and Mike did the inspection.
Someone from our outfit did an inspection?
Yes, sir.
And they agreed that,
In the simplest of forms, if it meets the definition, can anybody live there today? Then by definition, it's uninhabitable.
okay,
The law or the rules doesn't exactly, it says structure. Not house and not building, it says structure,
okay. I,
as I understand it.
in the future, I'll kind of look into this myself. And I totally agree. If it's uninhabitable, it's uninhabitable. I will vote positively. Although the words that are used, having worked for the sheriff in environmental enforcement, you and I are both know that solid waste is one thing and construction material that's inside of a building is not solid waste. But again, in order to appease my own curiosity, I'll take care of that.
Well, I mean,
Thank you.
if the board wants these things looked at a different way, they'll have to.
No, I'm just curious.
Well, you're basically taking the advice of the Gerard officials and putting him back in contact, like you did
Yeah,
this gentleman over here.
right, and the city's a little bit different because they have ordinances, we piggyback on their ordinances, like what the board, the motion is to make improvements, raise. Or secure, make improvements or raise its structure within 60 days. A lot of times they're making improvements, then we're up, well, that's what I was telling gentlemen, as long as you're trying, we're good to go with that.
Within reasonable.
Within reason, why Gerard City gave it to us, I don't have any knowledge of that, except for they think it's uninhabitable as well.
And I understand and agree with all that. I guess my only point is, if it did go to court, I would not want to be personally, along with my board members, embarrassed by a judge going, solid waste, that's not solid waste by the definition. So I want to recap all those things and make myself happy with them. Thank you.
Yes, sir.
Makes sense?
I'd further like to add that, at no time have I received anything from the city denoting any deficiencies in the building. Okay,
Me too.
and as far as things go, right now, most everything you're looking at, there's shelving and everything else is go back into putting the thing together. But I'm also allowed to use it for cold storage. That is permissible. I may have something in there from another building that I'm working on, but as far as any trash, rodents, anything like that, there's nothing there. I'm questioning what they're calling solid waste. It is not solid waste. And if it's uninhabitable, just based on when you're building a new house, they can't occupy it. I'm putting it back together, so I'm in the same situation.
With a new house, there's constant improvement in the structure. That's
Well,
what
there's
they're saying.
been constant improvement in this structure too. Since that time when the board first came to me, I've made improvements. Prior to that, I made improvements after I won my case, and I might be slow going at this. I'm just saying is, as I advised the board at the time that they declared it, when they condemned it, you have to have health code violations. There are no health code violations that I am aware of.
Isn't the Gerard officials closer to the scene than we are, and we're gonna abide by them? And this
Right.
enables you to talk to that Gerard official in the next 30 days. And then if we vote yes, we would certainly rescind that.
Right. But I'm just
What we're doing
saying
today.
is telling you
Yeah.
how this has gone down.
Oh, I respect
Okay.
what you're saying.
When was the court case? What year?
That was 2 strokes ago. I'd have to look.
This board didn't declare it unsafe.
No, it was the George City Health Board. And they hurriedly rescinded it when they found out they had overstepped their authority.
Well, you're familiar with the
It was through Judge Logan's court. And the attorney representing me was Bruce Broyles, who.
So we took, Gerard came with us in 15, so it had to be before that.
So before 15.
Yeah.
Okay, any other questions or comments? Roll call on the motion.
Mr. Dubus,
Yes.
Mr. Barry,
Yes.
Mrs. Salapatta,
Yes.
Dr. Förster,
Yes.
Mr. Adavasio,
Abstain.
Mr. Messersmith.
Yes, you know the procedure, we can resend it. Okay, I think that's all of those. The next thing, is there any comments from the citizens? Citizens' comments, we've heard most of them. Is there a motion to pay the bills? Second.
I'll second it.
Any questions on the bills? If not, roll call?
Dr. Förster,
Yes.
Mr. Dubus,
Yes.
Mrs. Salapatta,
Yes.
Mr. Barry,
Yes.
Mr. Adavasio,
Yes.
Mr. Messersmith.
Yeah, the next meeting is, April 24th, same time, same place. Is there a motion to adjourn?
So moved.
Mr. Barry, second by Mrs. Salapatta. Roll call?
Mr. Barry,
Yes.
Mrs. Salapatta,
Yes.
Dr. Förster,
Yes.
Mr. Dubus.
Yeah.
Mr. Adavasio.
Yes.
Mr. Messersmith.
Yes. Sir, you're getting tied with Warren Township as far as turning in cases for us.
Are you talking?
Yes.
I'm getting tied with who?